West Texas Counseling Guidance takes scientific-based, research-based, evidence-based models of therapy and techniques, and they announce freedom in people's lives who think they're enslaved. They're enslaved to addiction, they're enslaved to trauma, to loss, to anxiety, to depression, to marital issues, whatever it might be. And they take those techniques and they take those models of therapy and they pronounce freedom in people's lives and they walk them to that freedom. What I think the harder task is that West Texas Counseling Guidance also does, they're announcing to free people that they're actually enslaved. Because especially in our West Texas culture, we can inoculate ourselves into thinking that everything's okay. A lot of our neighborhoods, our lawns are well manicured and everything looks good, but it's not. We're in the midst of a mental health epidemic in this country, and especially out here in West Texas. And so West Texas Counseling and Guidance does that other prophetic work of shining the light on that and moving toward the hard, necessary, uncomfortable, and often awkward, tense conversations to saying, you are actually, think you're free, but there's a big problem here. But when they do that, the floodgates open up and people come out of the woodwork and you can have a kind of conversation that leads to healing and restoration and builds a better community.
It's been so unbelievably nice to have a center where I can send people so they can get the help that they need regardless of their ability to pay. I've never had one person that's been turned down from the center, and the impact that that has had on not just my patients individually, but also their support systems and their families and their friends. I mean, the impact is infinite.
The community now, has the support for mental health. It's just been such a shift in the last few years. People have really responded and recognized the value of good mental health services and the importance of mental health. The last 2 years, we've had awful suicide rates. So what can we do on the prevention side? And that is where Zero Suicide came in. What does perfect depression care look like? Well, if we had perfect depression care, there'd be fewer suicides. And then the question was, well, how many suicides are acceptable? And then that answer is 0. So that's where it comes from. We have counselors on standby where people can get, when they get screened by Shannon or the school district with high elevated levels of depression, they can immediately come in and they see that therapist, and once they see that therapist for safety planning and suicide prevention, then they continue on with that therapist until they get to where they need to be and the crisis is resolved and the depression is lifted.
They can walk in and they can see a therapist almost immediately, and they're being treated for suicidality in the community. So they're not gonna go and spend 3 or 4 or 5, 6, 7 days in a hospital. They're gonna go home at the end of that night. Within that Zero Suicide model, everybody has to own the problem, and you need people who are highly trained to be able to deal with this. So we wrote a grant in conjunction with MHMR. What that allowed us to do is hire a Zero Suicide coordinator, who's Danae Johnson. She's an LMSW. We trained about 176 people, and we got to do that for free, which that kind of thing doesn't usually happen. So clinicians from all around the state of Texas get to come here and get a training they don't have to pay for, and it's some of the best training they could get in the world.
The response to Zero Suicide has been amazing, and the number of clients utilizing that program is just, I could have never imagined how many people come in on a daily basis that are in crisis. In 2011, we had 4 therapists, 2 part-time, 2 full-time. And I think the total staff was 7. And now we have 37 therapists.
When I first started, we were in the one little office over on Magdalene. And now we have 6 offices in San Angelo. There's 9 offices outside of San Angelo. We cover a 19 county area. It's unreal to me how much growth there is. And really the growth is all very organic and natural. When people's schedules fill up and we start to get a waiting list, we hire somebody.
We have run out of space. The demand for our mental health resources has just been overwhelming, and we need more office space. And I think it's important for us to be under one roof. We're kind of spread out around town right now.
And what's happening now is there's confusion on where people need to go. So Somebody in crisis may show up for a zero suicide appointment here at the Cactus, and they're actually supposed to go to Magdalene, or vice versa. And so there's a lot of confusion on, and people, when they're in that state, it's very difficult for them. So they're not really, listening to, well, did they say the Cactus? Did they say, but it's continuous problems with that. So we have kicked off a new capital campaign to expand to 3 additional floors here at the Cactus Hotel.
So we're really excited that we will have 3 more floors, the 9th, 10th, and 11th floors, to have a children's center, a bereavement and training center, a veteran center, and have all of our administration in one place.
When you see the effects of suicide, not just in this individual, but on a community-wide level, and you know some things and you could be able to do something about it, you have a moral obligation at that point to do something about it. The problem with that is there's no money to be made in some of those things. You're not gonna ask these people for money. You're not gonna try and bill insurance. You're not gonna try and find a way to make that profitable. And that's where, the people in the community, the people who have means, the people who, they've been blessed financially. And in some cases, they don't have that much to give. They give $50, but that $50 makes a difference.
We don't turn anyone away, regardless of their ability to pay. And so for me to continue connecting with individual donors or having an event and allowing them to come and celebrate this, it really brings in the resources and the revenue that we need for operations, that we need for helping people with their co-pays, or if they're underinsured, or if they don't have insurance, and that we're able to get them in and get the significant resources they need at a critical time.
West Texas Counseling Guidance has an exciting future ahead, but a part of that future it requires fundraising. It requires getting, whether it be independent donations, securing grant money through foundations, whatever that may be. They can't do what they can do without that. And they're looking at expansion, they're looking at extending different kinds of avenues for people to receive help. We give to a lot of different things in our lives. We waste money on a lot of different things in our lives. So I'm encouraging folks to go through the work of discernment and figure out if you're someone that feels called to give to West Texas Counseling and Guidance.